COVID-19 case numbers and hospitalization rates remain high across the region. Health officials say it continues to be fueled by the Delta variant of the COVID-19 virus. BALLAD Health is reporting 381 COVID-19 patients in their hospitals today. 105 of them are in intensive care units, and 87 of those are needing ventilators to breathe while fighting the virus. Today, there are 4 pediatric COVID-19 patients in the Niswonger Children's Hospital. Joining us again, BALLAD Health Chief Infection Prevention Officer Jamie Swift. She joins us on Mondays, oftentimes with an update on what she's seeing. Jamie, welcome, and tell us what's your reaction to the numbers coming out of the hospital today?
Yeah, our numbers are still really high. Certainly, we've seen a little bit of a decline. We're kind of leveling off in that 380, 390 mark. I hope we can sustain and really not go back and peak any higher than we have been and continue to see a decrease. But the main message is that we are still extremely high. We still need community mitigation efforts to try to slow the spread down and reduce hospitalizations.
Are you still seeing a very high number of people in your intensive care units who have not been unvaccinated? What's the latest data on that front?
Yeah, I don't have the percentage right off the top of my head tonight, but we're continuing to run that 90 to 93% of all of our admissions are unvaccinated if they're admitted with COVID. So really what we see is the vaccine is working. It's keeping people out of the hospital and it's keeping them away from that severe disease.
We'd love your take on the big news today from Pfizer. They're saying that some preliminary testing, in fact, they're pretty confident. It still needs to be peer reviewed at this point, but confident that the vaccine is effective and safe for people ages 5 to 11. This does not mean the vaccine's available for them yet, but we'd love your take on that news tonight.
You know, it's very exciting. It's news that we've been waiting on. It's news that we've expected. So as the trials have been going on, we've been hearing that they've been going very well. And so now Pfizer has reached the point that they have the data. They can submit it to FDA, and it's going to go through that full process. So FDA will review it, then the CDC group, the ACIP will review it. And once all of those reviews happen, if it receives approval, then CDC will make the recommendations, and that's when it would become available to the public. Hopefully that will happen fairly quickly, but we'll see over the next few weeks.
We've seen everything fast track. I guess it's hard to say how long it could take. It could be a few weeks, maybe?
I'm hopeful that sometime in October we'll have that vaccine available. Certainly things can change, but that really is kind of what we're hearing, is that maybe sometime in October we'll have that for 5 to 11-year-olds.
All right, the booster shot is being rolled out right now. And there's been a lot of discussion and even some confusion about it. So help us be real clear tonight. Who is supposed to be getting a vaccine booster at this point?
Yeah, there's still a lot of confusion around it. There's still a lot of information. So right now, that 3rd dose is available for the immunocompromised, and so that's who we're giving the doses to. You probably heard the news over the weekend that the FDA committee is recommending the booster for those who are 65 and older, and then those who are likely to progress to severe disease. But that is still just that first recommendation. So it still has to go through the rest of the process. So that was one committee of the FDA. The FDA has to make their final recommendation. Then it also has to go to that Advisory Council on Immunization Practices. They're meeting this week. So hopefully by the end of the week we'll have more news about boosters, and if that expands to that 65 and older age group and those other high-risk groups. But right now, actively getting boosters today is strictly those people who are immunocompromised.
Let's focus in on flu shot, because I know you're also saying now is the time to get the flu vaccine. Now is the time to get the COVID vaccine. If you're immunocompromised, now is the time to get the booster. And for some, we're hearing that they're hearing from pharmacists and other sources that they either should get them both at the same time or they shouldn't get them both at the same time. And I think a lot of folks are just wondering, what do you think? Would you recommend getting a booster or your first COVID shot and a flu vaccine at the same time?
Right, and so it's not always what I think, it's the science, and so CDC actually changed their recommendation on that several months ago, that people can get the COVID vaccine or the COVID booster with any other vaccine. So that could mean if your child is getting their routine childhood vaccinations, they can get that COVID booster, that COVID vaccine. If you're getting your COVID vaccine or your COVID booster, you can certainly get that flu shot with that. You can get it the next day. There's no minimum waiting period. They can be safely given together.
Let's talk about monoclonal antibody treatments. I know that Ballad has really stepped up its efforts to try to make that accessible to people. Are you seeing good response to it? Are you seeing continued effectiveness to it? And what's the message tonight to somebody who turns up COVID positive as it relates to monoclonal antibodies?
We are still seeing a great response. So physicians, I think, are aware that they can write those orders and get their patients treated if they qualify. We certainly believe that treatment has really what has helped us level off in our hospitalizations. We really do believe that this treatment is keeping those people out of the hospital. Again, vaccine is by far the most important. So if you get vaccine, you certainly won't need that monoclonal antibodies and hopefully won't test positive. But if you do test positive, you do need monoclonals, then certainly we have that available. You can talk to your physician. If you qualify, then they can write that order and send that in.
And again, you're saying many people would qualify for this, right? Not just the highly at risk as we've come to label them, right?
Yeah, there's several qualifying factors. 65 and older is a factor in and of itself. So if you're over 65, that automatically qualifies you if you test positive. There's several things, several comorbidities that would qualify you. So if you have any questions, if you test positive, vaccinated or not, I encourage you to reach out to your physician and talk to them about if you qualify for monoclonals.
Jamie Swift helping us out with the latest from Ballad Health tonight. Thank you. As always, we really appreciate it.